41. Droplet precautions require a surgical mask for all patient interactions. True or false? Answer. True. Rationale. Droplet precautions require a surgical mask during close contact, within 3 to 6 feet, to prevent transmission of pathogens like influenza, per CDC guidelines. 42. Pain is always a physical sensation in patients. True or false? Answer. False. Rationale. Pain can be physical, emotional, or psychological, influenced by factors like anxiety or cultural beliefs, requiring a holistic assessment for effective management. 43. Nurses can modify a patient's care plan without consulting the healthcare team. True or false? Answer. False. Rationale. Nurses collaborate with the healthcare team to modify care plans, ensuring interventions align with medical orders and patient needs, per interprofessional standards. 44. Proper hand hygiene includes washing hands for at least 20 seconds. True or false? Answer. True. Rationale. The CDC recommends washing hands with soap and water for at least 20 seconds to effectively remove pathogens, a critical step in infection control. 45. Hyponatremia can cause confusion and seizures. True or false? Answer. True. Rationale. Hyponatremia, low sodium, disrupts neurological function, leading to symptoms like confusion, seizures, or coma, requiring careful sodium correction and monitoring. 46. The nurse should use a draw sheet to reposition a patient in bed. True or false? Answer. True. Rationale. A draw sheet reduces friction and shear, protecting the patient's skin and easing repositioning while minimizing nurse strain, per safe patient handling guidelines. 47. All patients should be bathed daily with soap and water. True or false? Answer. False. Rationale. Daily bathing with soap and water may not be appropriate for all patients, e.g., those with dry skin or critical conditions, requiring individualized hygiene plans. 48. The nurse should report a medication error immediately. True or false? Answer. True. Rationale. Immediate reporting of medication errors ensures patient safety, allows for timely intervention, and supports quality improvement, per facility policy and ethical standards. 49. Cultural competence requires ignoring a patient's spiritual beliefs. True or false? Answer. False. Rationale. Cultural competence involves respecting and integrating a patient's spiritual beliefs into care, promoting trust and holistic patient-centered care. 50. A patient's advance directive must be followed in all situations. True or false? Answer. False. Rationale. An advance directive guides care but may not apply in all situations, e.g., reversible conditions or unclear wishes, requiring consultation with the healthcare team and family. 51. Contact precautions require gloves and a gown for all patient interactions. True or false? Answer. True. Rationale. Contact precautions require gloves and a gown to prevent transmission of pathogens like MRSA or C. difficile during patient interactions, as per CDC guidelines. 52. The nurse should assess a patient's fall risk only upon admission. True or false? Answer. False. Rationale. Fall risk should be assessed upon admission and ongoingly, e.g., with shift changes or condition changes, to ensure safety, per Joint Commission standards. 53. SBAR is a structured communication tool for handoff reports. True or false? Answer. True. Rationale. SBAR situation, background, assessment, recommendation, standardizes communication during handoffs, improving clarity and patient safety as endorsed by the Institute for Healthcare Improvement. 54. Bed baths are necessary for all hospitalized patients daily. True or false? Answer. False. Rationale. Bed baths are individualized based on patient needs, skin condition, and mobility. Some patients may require partial baths or alternative hygiene methods to avoid skin irritation. 55. A pulse rate of 55 beats per minute is normal for an adult at rest. True or false? Answer. False. Rationale. A pulse rate of 55 beats per minute is below the normal range, 60 to 100 beats per minute, for an adult at rest, indicating bradycardia, which requires further assessment. 56. Hypernatremia can cause thirst and confusion. True or false? Answer. True. Rationale. Hypernatremia, high sodium, causes cellular dehydration, leading to thirst, confusion, and potentially seizures, requiring fluid administration and monitoring. 57. The nurse should double-check high-risk medications like insulin before administration. True or false? Answer. True. Rationale. High-risk medications like insulin require a double check by 2 nurses to verify dose and patient, reducing errors per medication safety protocols. 58. Massage is a safe pain relief method for all patients. True or false? Answer. False. Rationale. Massage is contraindicated in patients with conditions like deep vein thrombosis or skin infections, as it may worsen complications, requiring careful assessment. 59. Nurses are ethically obligated to advocate for patient autonomy. True or false? Answer. True. Rationale. The ANA Code of Ethics emphasizes patient autonomy, requiring nurses to support patients' informed decisions and preferences in care planning. 60. Documentation should include only positive patient outcomes. True or false? Answer. False. Rationale. Documentation must include all relevant data, including negative outcomes, complications, or unchanged conditions, to ensure accuracy and continuity of care. 61. Ambulating a patient early after surgery prevents complications. True or false? Answer. True. Rationale. Early ambulation post-surgery promotes circulation, prevents deep vein thrombosis, and enhances recovery, as supported by enhanced recovery protocols. 62. Alcohol-based hand rubs are effective against Clostridium difficile spores. True or false? Answer. False. Rationale. Alcohol-based hand rubs are ineffective against C. difficile spores, requiring hand washing with soap and water to physically remove spores, per CDC guidelines. 63. The nurse should use a tympanic thermometer for all patients. True or false? Answer. False. Rationale. Tympanic thermometers are not suitable for all patients, e.g., those with ear infections or infants, requiring alternative methods like oral or rectal for accuracy. 64. A patient's cultural beliefs should be ignored during care planning. True or false? Answer. False. Rationale. Cultural beliefs must be integrated into care planning to provide patient-centered care, respecting preferences and building trust, per ANA standards. 65. Therapeutic communication includes maintaining eye contact with all patients. True or false? Answer. False. Rationale. Eye contact should be culturally sensitive, as some patients may find it uncomfortable or disrespectful, requiring nurses to adapt communication techniques. 66. Incentive spirometry prevents postoperative atelectasis. True or false? Answer. True. Rationale. Incentive spirometry encourages deep breathing, expanding alveoli, and preventing atelectasis in postoperative patients as part of respiratory care protocols. 67. Medications can be crushed for administration without verification. True or false? Answer. False. Rationale. Crushing medications, e.g., extended release or enteric-coated, can alter their pharmacokinetics, requiring verification with a pharmacist to ensure safety. 68. A blood pressure cuff that is too small can falsely elevate readings. True or false? Answer. True. Rationale. A too small blood pressure cuff increases pressure on the arm, falsely elevating readings, requiring proper cuff sizing for accurate measurement, per AHA guidelines. 69. Nurses should report all changes in patient condition to the physician immediately. True or false? Answer. False. Rationale. Nurses assess and prioritize changes, reporting significant or urgent changes immediately, while documenting and monitoring minor changes, per clinical judgment. 70. Proper lifting techniques include keeping the load close to the body. True or false? Answer. True. Rationale. Keeping the load close to the body during lifting reduces spinal strain and leverages core strength, preventing injuries, per OSHA safe handling guidelines. 71. A patient's pain level should be assessed only when they request pain medication. True or false? Answer. False. Rationale. Pain should be assessed regularly, not only on patient request, to ensure timely intervention and effective management, per pain management standards. 72. Airborne precautions require a negative pressure room. True or false? Answer. True. Rationale. Airborne precautions for pathogens like tuberculosis require a negative pressure room to prevent pathogen spread, as mandated by CDC infection control guidelines. 73. Fluid restriction is appropriate for all patients with heart failure. True or false? Answer. False. Rationale. Fluid restriction is individualized for heart failure patients based on severity and symptoms. Some may require monitoring without strict restriction to avoid dehydration. 74. The nurse should verify a patient's allergies before administering medication. True or false? Answer. True. Rationale. Verifying allergies prevents adverse reactions, ensuring patient safety, and is a critical step in the medication administration process, per Joint Commission standards. 75. Advance directives are only for terminally ill patients. True or false? Answer. False. Rationale. Advance directives apply to any adult patient, specifying care preferences for future incapacity, not just terminal illness, per ethical and legal standards. 76. A respiratory rate of 22 breaths per minute is normal for an adult at rest. True or false? Answer. False. Rationale. A respiratory rate of 22 breaths per minute is above the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating tachypnea, requiring assessment. 77. Hand hygiene is required only before invasive procedures. True or false? Answer. False. Rationale. Hand hygiene is required before and after patient contact, before aseptic tasks, and after exposure risks, not only for invasive procedures, per WHO guidelines. 78. The nurse should use a gait belt when assisting a patient with ambulation. True or false? Answer. True. Rationale. A gait belt provides support and stability, reducing fall risk during ambulation, especially for patients with weakness or balance issues, per safety protocols. 79. All patient complaints should be documented as subjective data. True or false? Answer. True. Rationale. Patient complaints, e.g., pain, nausea, are subjective data, reflecting their personal experience, and must be documented accurately to guide care, per charting standards. 80. Hypomagnesemia can cause cardiac arrhythmias. True or false? Answer. True. Rationale. Hypomagnesemia, low magnesium, disrupts cardiac electrical activity, potentially causing arrhythmias like torsades de pointes, requiring magnesium replacement.